everyone.
Yes, ma'am.
So let me come to the question, will we ever be the same again? See, this is not very different from any other crisis. Okay, I was working with children after the tsunami. And even at that time, it was more like I was trying to see how we can help them get past this situation here, as well as see how to make the world look like a better place. Because as of now, they see a world which is filled with this virus. So, will they ever be the same? I think in a lot of ways that yes, their unconscious is being filled with a lot of information and not very good information. But that is the importance of today's program. You know, we need to identify that if we don't do anything about it, then it's just going to be like they're just going to be carrying information about this in exactly the same way. So that is why we need to talk them, we need to make them express, and we need to provide them an alternate perspective of the future. Even this shall pass, this is not going to be permanent, and you know, you will be able to. So maybe 3-year-olds and 4-year-olds, you can say, yes, of course you can step out of the house, but wait for some time, let us clean it, let us sanitize it, and then we'll go. So the world is going to get sanitized, and we have to definitely tell the children that. And of course, there are adolescents and people who are waiting to do their JEE or their NEET. It's a huge disappointment for them, and we have to be there to help deal with this situation. It's the answer, the long and short of it. It's not going to be exactly the same, but what we can do is, the key word is to mitigate, is to lessen the impact of this situation. Because believe it or not, I think we are hearing it's not going to be just because we open up doesn't mean that corona is going to go away. It's still going to be there.
Ma'am, good evening, ma'am. I have a question.
Yes.
As a school counselor, am I going to face the challenges with the children in future?
Absolutely. I think I actually made this out for counselors, and then I just turned it into adults. I started off with counselors actually, because see, as school counselors, yes, it's going to be an uphill task. And I know some of my friends who are in residential schools, it's going to be an upper hill task for them. So yes, they're going to bring in so many thoughts and so many myths about corona. They must have had, they hear something from the grandmother, they hear something from the aunt, and they're going to bring all this, all their anxieties, their physical, social, cognitive, emotional, all these reactions, they're going to follow it definitely into the school, and counselors are going to be able to going to be having to deal with it. So here, what I say is that as counselors, we should take the teachers' help. So train the teachers in psychological first aid. Okay, even before school reopens, talk to the teachers, give presentations like this, say that, look, this is what we are going to expect the children to be. They are going to come here, it's not going to be the same children we left back in March. They're going to be different children. So please expect it, and please see what you can do at your level. So it has to be a step-by-step intervention, So if you can't deal with it, then you bring it to me. Don't bring everybody to me at once. I won't be able to deal with it. So okay, empower the teachers. But yes,
ma'am, thank you for your valuable answer, ma'am.
Thank you. Yeah.
How do you suggest the teachers should expect, or how can they deal when they're taking classes, classroom management?
Oh, that is going to be difficult. See, first thing is, see the for the last few years we've been hearing about mindfulness has been there forever, right? But for the last few years it's come up so much. What does it say? It says focus. All right,
Yes.
watch it, watch the reaction without judging it, right? So if we as class teachers are looking at children who are restless and who are, some people are paying more attention, some people are not paying attention, some people are physically restless, some people are agitated in their minds, some people, you probably will have a lot of absenteeism when you go back to school. Children may not want to come because of that clinginess, remember, that we talked about. And some people come to school with they're so withdrawn, and all these reactions that we talked about, expect all of them and try to make your lessons in such a way that you will be able to deal with most of them. So it's not about portions, it's not about completing the syllabus. I think you should have an orientation. Every school should have an orientation week where you bring the children in and first let the teachers talk to the children. First start off by talking to the children. How have you been? What has happened? Has anybody died? Has anybody been ill? Have you been ill? So what have you been doing at home? So every teacher needs to connect with the child personally for the first week, and then slowly start off with little by little, because don't think that okay, it's not like a switch that you can switch off and switch on. So they have been off. even
Yes.
even those schools which are doing online and everything, even then
It's a Herculean task.
it's a Herculean task. It's a Herculean task. Yes, yes. And it's going to be one.
Well,
Definitely it's
yeah,
going to
yeah.
be.
And maybe we have to change the teaching methodology.
Yes, yes. Excellent. That's what I'm looking at. Teacher, the whole methodology should change. The focus should be something else.
Yeah. Ma'am, I have a
Ma'am,
question, ma'am. Radhika, I have a personal question, I should say. My son is actually in 10th standard, and his, about the state board examination has been,
Yes.
cancelled, and now it is postponed, and they never knew what is the date it's going to happen. So
Mm-hmm.
he is preparing very well and very much with an Josh he was preparing. Now the entire motivation has gone down.
Yes.
And again, asking him to study itself is making an, for me, it is a kind of forcing him something which is going to happen or not. There is no surety, and even otherwise also he's saying that I have done with so many times I've read. I'm not
Yeah.
having an inclination for studying and all. I have told him whatever you are getting, it's not about mark in life. Whatever you are getting is fine, my dear. You should not regret back. Just be prepared for the examination. If it happens, whenever it is happening, you should be able to face it. That's all I have told him.
Right.
But still, there is a kind of an uncertainty. We know that it is not under our control. But he's posting an WhatsApp message to me with his friends and the family group. The old women are appearing in uniform, and after the lockdown they are writing their examination. This is it's a comedy pic, okay. All are old women with an uniform, and they all come with an 2 plates and the uniform, and they all appearing for 10th examination. He's saying this is the state for 10th examination after lockdown. So it gives me a clue that he is having a kind of an apprehension about this entire scenario. But I have been telling him, what about the boys? I was just asking him, what about the boys? They would have not even woke up to see the message, ma. That kind of laziness has been there in their blood right now. So regulating them and getting starting and again rebooting them towards an examination, and again kind of and same kind of the positive vibe is very difficult.
Absolutely.
How can
Dr. Radhika, can I?
too with an adolescent, what could be one kind of some kind of boosting you can provide me?
See,
Dr. Radhika,
yes.
may I share a small pointer?
Yes.
There is a movie that came out called Life is Beautiful by Roberto Benigni.
Yes.
That is a movie that is that we all should watch during these times.
Mm-hmm.
because it talks about how a father creatively protects
Yeah.
the child,
Yes.
his son, in the concentration camp,
Right.
during the Second World War, to prevent the child getting traumatized from all the the terrible events that were happening around them. So I wanted to share that might be a movie 4 times today. Thank you.
Yes, yes. Thank you so much for that, Lynn. See, that was with a child who was very, very young. And children very young, it is very easy for us to take them into a world. Yeah, to take them into a world that we want them to be in. But the older they grow, they know the things. I mean, if that boy was probably 12 years old or 13 years old, where the formal operational stage, he's grown up, his cognitive development is higher, he's not going to believe any of what his father says, because he knows exactly what that place is. So that kind of an approach may not work with what Dr. Subhashri is saying, where uh, an older boy, a boy who is a boy or a girl who is 14 or 15. Yes. So I think, Dr. Subhashri, you are doing a great job, not stressing marks, and you're saying that it's okay for you to do whatever it is. But here I will tell you that you know your son the best, and if you can trust him that he is going to do the right thing, then that's one way in which you can look at it. And then all we do is, I don't know if that's what you do, but in a lot of households, I've seen many people say, I don't care, I don't care, I don't care. But then even that small question of, in the morning, Beta, have you studied? Do you think you should study? That one little question, it just throws that boy off.
Irritates them actually.
It irritates them.
Yeah, it is not me, it is about the entire family. They all are looking that board exam is one of the destiny in their life.
Absolutely.
So even I could actually take care of this scenario. Entire scenario is not within my hand alone.
Yes.
There are people. I have to really do everyday psychoeducation for all of them. The elderly people, they don't understand. The mari vettiya podu pokreda, TV pakreda, ipdi pandreda. He's saying literally, I'm killing my time. I don't know what to do. I'm bored. What else I
How
can do?
long will you study the same thing over and over again? How long will you do it? Yeah. So it's a difficult situation. I think there's a lot of trial and error, and I think as a psychologist, you know exactly all the things. You're trying everything out. But it's not magic, I can't pull anything out of the hat and say this is what you need to do. Just understand him, be there with him, patience, compassion, allow him to come and speak to you, express his agitation, his irritation with the grandparents or with any older people, with people who are asking him questions that he has no answer for, and do that, and trust him that you've raised him well. So trust him that he will do the right thing, and he will definitely study when needed. I'm sure he has gone over his portions over and over again. His exams are
even
1.5
even if
months.
he is stuck, we cannot do, because this is the time people go through such a tough time also.
Yes, definitely.
Ma'am, I have one small question. I don't know, small or big. I have a question. It's been 1 month, children are given online sessions, and after some time when they're coming to the regular stream, are they going to cope up with the classes, ma'am? This would be like a challenge for all of the teachers as well as, and every teacher would definitely suggest those students to me, being a school counselor, how I'm going to deal with them. It's going to be a biggest task. Already as of now, 50% of students I deal with regularly, but the percentage would become higher. And I don't know, like any booster for a school counselor so that I can be more energetic again.
Yes, it's a true situation. You have to be there. Now, it is not only for the children you're a counselor anymore, you're also a counselor for the teachers. So you probably, I think all of us as counselors need to do a lot of, probably meditation, yoga, and mindfulness and things like that, just to keep our patience, just to be able to be compassionate when we can so easily get irritated, and just to maintain that patience level where we don't have to say, can't you see that this is what it is? It's so easy for us to say. It's like, can't you see it's right in front of you? What do you expect me to do, kind of thing. Those reactions, if we are calm and we are reassuring, I'm sure we will spread that calm to the teachers, empower them with certain skills, and definitely give them something. This is what your children are going to be. See, this is something that I've always said. There are a lot of givens. To all teachers, I say, there are givens. So this is what children are going to be. So once we establish that, we're not going to be fighting that. If I can't fly, I can't fly. It's a given. So I'm not going to be irritated and feel hopeless, worthless, powerless because I cannot fly. Right? So I think it is important for everybody to understand that these are givens. They're going to have these physical reactions, these cognitive reactions, these emotional, these social. They're going to be this. This is the kind of children that you are going to get back. So what are you going to do? So empower them. The moment you understand that, once that acceptance comes, automatically the compassion will come.
Thank you very much, ma'am.
But it's a tall task. It's a tall task.
Ma'am, I had a question, somewhat related to what ma'am asked last.
Okay.
Actually, I think one of the main that you mentioned in the end that there would be some cognitive changes. I think one of the biggest changes that will be there in every human being, whoever is going to go out and work, probably, whether they are professionals or children who are going to study, is going to be motivation.
Yes.
Motivation to do what they used to do for so long and then going back to it. And I think a lot of children will be having some reactions to it in terms of inattention, not being able to sit in a place for a longer time.
Yes.
Yeah, a lot of things like that.
Yes.
So
yes.
Specifically, I don't have a question, but if as psychologists, when we work in a school setup especially, or in a workplace setup, how do we, if there are any practical ideas that you have that we could help them to get back to being motivated to what they used to do earlier? Because there is a higher chance they might have lost it, if not become less in it. So
perfect. Very, very beautiful question. Thanks for asking that question.
Thank you, ma'am.
So apart from being a counselor, I'm actually heading an institution for people with mental retardation. We have 40 adults there who have mental retardation, and we're running this residential facility for them. And since the 1990s, I have been teaching psychology to people who are doing B.Ed in special ed. So this kind of a situation, really, I think special educators are going to do a really, really good job, because they are trained for restlessness, and they are trained for lack of concentration. They are trained. They're trained for this, and they do this IEPs, the individualized educational program, and they kind of make their lesson plans so that they are able to reach these children who have deficiencies, a lot of cognitive deficiencies, not only in IQ, but in attention and in perception and in learning, memory, thinking. See, all these cognitive processes, they're going to find a problem doing. They're not able to concentrate. They're going to be restless. So yes, all the teachers should be able to make lesson plans so that you cater to every single person. So it has to be interesting. Your lesson plan should be interesting. It should not be monotonous. It should be very interactive. It should have a lot of activities. So if you do these things, you will see that all those 30 children in the class are going to be interested in what you have to say. They will be engaged in what you have to say. And that is our, and it's going to differ for various classes. If you're going to be a teacher in 3 different classes, the same lesson plan is not going to work for all these 3 classes. So you're probably, each class has a different culture. It has a different, feel to it. The attitudes and everything is different for each class. So the teacher should be aware of that, and this should be done. Your lesson plans is the thing. Keep them engaged, make it interactive, give them lots of activities, and make it fun. And enjoy yourself.
Ma'am, more than class,
Thank you so much, ma'am.
every individual is unique and every individual has different shortcomings, no ma'am?
Absolutely, absolutely.
So 30 lesson plans we need to go with.
I think we try to, like in research, I think we group, okay, so there is one lesson plan. It's called differentiated classrooms, right? We have these kind of differentiated classrooms where children of this, so it's like a bell curve. So the maximum number 66.67% of the people will get one, but then you have to have something for the people on either side of the bell curve, right? So this you have to do that. Yeah.
Ma'am, what about the adolescent children, ma'am? They feel that, what is there to learn? Do the activities and all I can learn from YouTube. I'll just Google. I'll learn on my own. Why should I get engaged in the class and all? How to deal with the adolescent children?
See, good question. I have been asked that question by many people. What I tell teachers is that your personality, what you emanate from your persona is very, very important. So if you have a YouTube video or you have an activity which is fun, which you think is fun, you should also see to it that it is fun for them also.
Yes, yes.
And when you engage them, it cannot be an up-down paternalistic attitude cannot come out. You have to be one of them, enjoying the activity with them. Even if it is, I have my adult counseling group adults doing all sorts of monkey business. People who have attended my workshop will know. I mean, I ask them to do a lot of monkey business. Okay, just get back into that. But it's, of course, some of them will say why, but then when they see the others enjoying it, they will also join in. And adolescents are not that different. They can be rebellious and all that. But then if they see 60-70% of the class enjoying a particular activity, then they also kind of join in. So it's up to us, I think.
Ma'am, but all the topics cannot be made into fun, and there are certain topics which are very theoretical and all. How to tackle that?
That is the challenge. That is the challenge. See, if we think that we should, I'm not saying just fun. I'm just saying interesting. Make it interesting.
I got it.
All topics you can't just make funny videos and show it to them. But make it interesting, engage with them, talk to them, bring them into your way of thinking. And even the most serious of topics, today's topic is not, is so serious. Today's topic is so serious, but then we're having a nice fun discussion about it, right? Not saying anything. There are so
Thank you very much.
Thank you.
Ma'am, I have a question. I'm Dr. Veena.
Yes.
See, ma'am, we are worried about the screen dependency among the kids. But right now, due to this lockdown, all the classes are taken online.
Yes.
How is it going to affect the kids? See, on one hand, we are saying the kids are more exposed to the screen
Yes.
dependency. But all the classes are right now going online. So aren't we trying them to expose to this sort of learning?
So what is it that you see? What difficulties that you see?
I mean,
you're asking this question because you have a certain doubt in your mind. Can I know that doubt?
Yes, ma'am. We say that too much of screen, looking at the screen will have an effect.
So how to differentiate this screen time with the rest of the screen time? Because what screen time we we talk about is the Facebook and the WhatsApp and things. And so now they're see again, it's attitude that we develop and make them differentiate between this and that is up to us to do, right? So when we talk about, see, there are so many things which let me think of an example where not if anybody else can come up with an example where I think it's both are the same superficially on the top, but then when you go deeper, they're not actually the same. So every child should be taught that this screen time is okay and the other screen time is kind of, no, I'm not saying not okay, but make them differentiate this and that.
But the kids might argue, isn't it? You say that online classes, those screen dependency are okay, and while we are playing, this screen dependency is not okay. So
Right.
how to make them know that sort of rational?
Yes.
thinking?
So what is the goal? What is the goal? What is the goal of online classes and what is the goal of video games?
See, it's not the goal, but right now everyone is forced to have online classes right now.
No.
All the
I'm
schools are
saying,
going.
no. What I'm saying is when you talk to them, if you
Okay, I
can talk
understand.
about the goal,
Okay, ma'am. Okay.
online classes achieve a different goal. And you need that for something else. They are only a temporary substitution for books and school. That's
I would definitely like to contribute, Dr. Radhika, on this. See,
Okay.
probably you can show them the outcome of having a non-utility screen time and a utility screen time. As in, nowadays you have all the files coming only through the screens, including your even if you go to the schools, your assignments are sent through PDF files and you have WhatsApp groups. So it's not that you can completely avoid the screen time. So they can have, or probably you can reward them with a fun time, screen time, and let them know the implications of not following it, and then go ahead with it, right?
Right. That's all I meant. I'm saying that they need to differentiate between this online and that online.
And it's a special time situation. That's why we are
Yes.
giving them learning on the internet. Yeah.
Yes, absolutely. And it is temporary. Please do not take that word temporary
It's a
out.
temporary.
It's not going to be forever. It is just a temporary substitute for books and teachers and school. That's all. It's not going to be easy. There are no easy answers in this situation. And a lot of times I think a lot of it is just by trial and error. So what I say now, you can try. It may work, it may not work. But it will probably give you an idea as to, what more can you do? What else can you do along the same lines kind of thing.
Ma'am,
But very perceptive question.
yes. Any questions from the participants? Can I add? Yes, ma'am, I will take. I think based on my personal experience, so many of you here are psychologists and mental health professionals. I think once in a time you may have encountered that when you are not able to manage the behavior of our children. Our spouse will ask, what you have studied? So this is the question I got it recently. Even I tried to meditate. So this is a recent one. And once my son told me that, sir, wow, that teacher class is very boring. Okay, I never believed him because he was very cordial when I was interacting with her. When I was sitting along with him in the online class, he is 200% correct.
Yes.
Yes, and when they started the online classes, he was very eager to attend the classes. But right now, he never sits 10 minutes. He's saying that it's boring. Why are you asking me to sit? I learn a lot from other than the online classes. Please let me allow to play. And I compelled him, even I forced him, I tried whatever the way I know I tried everything, but I failed. My wife will come and say, so what you have studied?
See, there are two things I want to say here, Dr. Suresh. Exactly what you're saying. See, when we move to online counseling, we have not, even though we have moved to this, we are not making full use of the online facilities.
Yes.
We are just continuing the way we will teach in a regular classroom, and that should not be done. That should not be done, because in a regular classroom, the experience is different. There are children sitting this side, that side, you're passing notes, you're looking at each other. If you're bored, you're doing something else. But imagine sitting on a table in front of the laptop or PC, or in front of the screen, and somebody just going on and on and on about this. Of course, it's going to be boring. So when teachers have this new thing of, they can share this. If they're doing it on Zoom, share your video, share your do it as a PowerPoint. So what if the child is 4 years, 5 years in the 6th standard or 7th standard? Do something more interesting. Show them a video, make them play single, have them sit with their parents, and both of them, okay, just imagine that your father is your partner. There is so many things that you can do in order to make this online education more fun. That's why we have these apps, this Baiju and this thing.
Yes, ma'am.
Where they make it so interesting. If it was so boring, they would not. So teachers also have to understand that this is a new experience for their children, and how they should adapt. If they're going to, I know for a fact that when I was doing my MSc, my teacher was reading from torn notes. I said, from there till today, cognitive psychology is something I have a problem with, because she was reading the notes probably that she got from somebody else. That is not going to work. You have to update yourself, and you have to adapt to this situation. It's the children. If the children haven't learned, it's not because they haven't learned, it's because you haven't learned. The onus is always on us.
We have to use
Perfectly said. Yeah, sorry, Subhashri ma'am.
Yes.
Perfectly said. I just wanted to add, there were a couple of parents who called and said, as in the children switch on their online, this one, sit there for 10 minutes and then switch off the video and switch off the audio, and they go off to sleep.
Yes, I know that one of my friends, and I think she's watching here, she said that they had this on Zoom. No.
That happens even in the classroom, actually.
But no, at least you can get to know it, right? At least you can get them some activity and awaken them. But this is not the case. You can't know. And the parents, knowing it, they cannot force, because these days the adolescent children are, need to be a little, you cannot push them a little too hard. It has its own repercussions.
Exactly. And that I was just saying that friend of mine, she said that one of the children had his video off. And so the teacher said, all of you immediately switch on your video, and he is lying down in the bed and just having that in front of him. So anyway, I mean, we have to adapt. Yes, we have to adapt.
I guess the teachers can bring in a new novelty as an out-of-the-box creativity. We have this, when we were teachers in school, we had twice in a year. We have to bring how new you can produce or teach a lesson. We have to show that to the management, and they would gauge us on that and then give us a grading. Right. The teachers were also given assessments.
Right.
Right now, they are so conditioned with the traditional way of teaching methodologies.
Yes.
And incorporating life skills methodologies into the teaching.
True.
Very essential. Experiential learning at the age of adolescence, and even for adult, it is very easy
difficult
for learning. Yeah. So we have to really create such a kind of learning atmosphere.
True. It's going to be a different world. I mean, whether we're going to say that to our children or not, I think we should understand that the world is going to change. Already TCS, working from home, and all these people have made it permanent, working from home and all that. So, yeah.
And
I have one more question, Radhika. This is regarding, especially when it comes to we have been talking about the adult, those who are special need children, and adults also is mentioned. And one of my friend, he's there, Krishnan asked about autism children. How these autism kids could be managed and engaged, because we know their difficulties. It is quite different from other normal kids and even the other special kids. So how it could be mentioned and how it can be actually managed.
Okay.
It's a great challenge, actually. I know.
It's a huge challenge.
I have my cousin's son who was an autistic child, and it so happened that she also went to whenever she took him along for the therapeutic classes, she went along, and now how she engages him is she gives him activity, as in he has to help her around, or give some game activities. Spend some time around, and that's how they do it at home at their place now. Radhika, if you can add more.
Yeah. So exactly. So I think children with autism, I don't think it is any child who has an activity problem, whether it is ADHD or whether it is autism, where you're not able to, they're not getting it from you. You have to be creative. Children, it's naughty, and we don't know even what they're going through. So at this time, I would say that, I'm going out on a limb and saying that with children who have special needs, just keeping them inside the house itself is a big thing. Yeah. And then on top of that, if you want to give them any gyan, or you want to give them some reading material or studying material, I don't think it is the right thing now. I think it is, then it will, they will carry with them a very, very negative idea of the situation. So I think as of now, just concentrate on keeping them happy.
Even the hyperactive, even with this hyperactive, they actually really wanted to go out.
Absolutely. Just maintaining them becomes a challenge. I don't think we should, even for children up to standard 6, I don't think they should be taught anything. I'm so sorry about any
teachers
who are teaching. Yeah.
I don't think these 2 or 3 months is really, really going to make a huge difference in the whole life.
As they are not going for IAS or IPS, ma'am.
Yeah, up to standard 6,
Yeah, ma'am, that's what.
More than adults, children are able to adapt very well.
Yeah. Just don't have classes. Absolutely.
Yes, Suresh, sir. Go ahead.
Yes, sure. Thank you, ma'am, for that amazing interaction. I think
thank you. It's been amazing.
And the way in which I'm saying this is an online platform. There is no difference between real life classroom and an online platform. For such a teacher, we need for my son. Thank you, ma'am, for amazing presentation, amazing engagement.
Thank you.
We will have.
Thank you, ma'am. Thank you very much.
Thank you so much, ma'am.
Thank you all.
Thank you,
ma'am. Thank you, ma'am.
Radhika, ma'am.
Thank you so much, ma'am.
Thank you, Amitabh.
Hi.
Thank you, ma'am.
Yeah.
Yes.
Thank you.
Thank you. And then express your gratitude. We are having 30 more seconds.
It's been lovely meeting all of you. Lovely meeting. I hope to get this opportunity another time. It would be lovely. Thank you. Bye-bye.
Bye, Radhika.
Bye.
Bye, Krishna. Bye. Thank you, Suresh, sir.